My name is Dr. Al-Hussaini, and I'm a cardiology consultant who is specialist in intervention, but also I have a niche specialist interest in women and heart disease, where I've done my research, and I run specialist clinic for it. Women and heart disease is a very common problem and probably underdiagnosed and mismanaged across the UK, but also I think is a world issue as well. We know cardiovascular disease is very common. We know cardiovascular disease accounts for major mortality and morbidity in the world, not just a first world problem, but also across the whole globe. And we know mortality is rising as a result of cardiovascular death as well. It's not just in men. If we look at the trends, there is an increasing trend of women being diagnosed with cardiovascular disease, but also cardiovascular mortality as well, which is death attributed to it. Women present very differently. They present the different symptoms. So unlike the conventional adverts that you see of a belt across the chest on adverts on the billboards, women don't tend to have these symptoms. They may present the symptoms of breathlessness, a bit of chest discomfort, reflux symptoms, vomiting, flu-like illness. So the symptoms are very varied and very different to how we perceive a heart attack to look like from a clinical perspective. And unfortunately, as a result of it, they tend to get misdiagnosed or underdiagnosed and mismanaged with late presentations. Also, women tend to present much later for several reasons. It could be because they don't think they're having a heart attack, because they would assume that their symptoms would be different and they have high tolerance to pain. But also they present later because they are assuming that they will be seen by a clinician who would diagnose them of having a heart issue. And often when they present to accident and emergency or to their clinicians, they would be treated for other causes of chest discomfort or breathlessness, and not necessarily the first diagnosis or the differential diagnosis would be heart disease. Risk factors in women are very different as well. We tend to look for conventional risk factors like smoking, obesity, etc. But these are not the conventional risk factors we find in women which increases the risk of having heart attack. Things like misdiagnosed hypertension, underdiagnosed hypertension at early age, having a history of preeclampsia or eclampsia in pregnancy, multi-gestational pregnancies, or having had lots of babies in the past are all risk factors. Other things include depression, include high BMI, obesity, and a strong family history of heart disease. Unfortunately, none of these risk factors are in calculators that we use when we risk stratify a woman for having heart disease, and for that reason, I think we underdiagnose and misdiagnose and mismanage women. Let's not forget, menopause and perimenopause and early menopause are also independent risk factors for women in heart disease, and there's so much to learn about that and so much to understand in terms of how that affects women who develop heart disease at young age and how it can be used to prevent. These risk factors can be better managed to prevent and reduce the risk of heart disease in women who are already predisposed.